Denise. So Denise, I would love to know from you, how did you hear about LifeWave, and what was your life like before, and what's been happening now?
Well, I ran into LifeWave at a convention in Los Angeles in March. So I've only been using the patches for like maybe 2.5 months now. When I was volunteering there, so when I made it to the booth where LifeWave was, she Sunday convinced me to go in the bathroom and put the ice wave on, and I was like, all right, fine, I did it. And she called me a day and a half later and was like, so how's your pain? And I'm like, what pain? I totally just forgot that and that was unheard of before that. My pain in my leg was, it made it hard to sleep even. So when I shocked myself by going, gee, wow, it is gone. So that's what brought me to LifeWave.
Wow. So Cindy basically said, I'm going to pop the spot of pain with that ice wave. And you came back, and pain's gone. And by the way, I heard that, sometimes, we just talk about pain like it's like almost like an afterthought. But did you hear? Well, I was in a lot of pain. I didn't sleep at night. I mean, like, that's kind of like tough. You're in so much pain you didn't sleep. So then you basically you started patching with what, X39 and Eon and Ice Wave. What did you patch with, Denise?
I patched with the X39, the glutathione. What's the one that starts with a C for the brain at the
carnosine. I love
carnosine, because I've had a couple of brain injuries. So, but my goal was to, so it was the ion, the glutathione, the X39, and the carnosine is what I started with.
And you say you had some brain issues. So what's been going on now with that for you?
I remember a lot more now, but that's not the biggest surprise that I got recently.
What's the surprise?
Okay, well, going back a little bit, since 2012, I had a lesion next to my adrenal gland, and over from then until 2021, it ended up turned into a mass, which in 2021 they told me that it was extending to my spinal cord, and that it was developing a nerve sheath tumor attaching to my spine. So I was like, that's not good. And they sent me to all the doctors, blah, blah, blah. They, of course, you're fine. It's nothing to worry about. I didn't believe them because that's where the pain was coming from. It was cutting up some of the nerves. Anyway, so I went to, they did a CT scan periodically over the years. In 2021, they did a CT scan. And my doctor just ordered one last week. So I went for the CT scan. I already knew there was going to be, this was my thing. I got to see, I feel so much better. I want to see what happens, what comes up on this test. So when I went down there, now they were supposed to do two, one before the contrast and then one after. Well, he did two without the contrast, and he just was like, he had a bewilderment. So he came in, he did the contrast, and he did the test. And then he came back in, and he is like, I need you to stay on the table. I need to wait 15 minutes. I need to come back in and scan you again. So I was scanned 5 times. They ran me through, hold your breath, wait for the machine to come back out. And not realizing at the time why he was redoing these tests is because he wasn't seeing what he saw in 2021. And so he didn't even, in my report, he didn't even mention that he did the pre-contrast scans, because he wasn't seeing anything that he was supposed to be seeing. So he thought he did something wrong. Poor guy.
Oh, wow.
In hindsight, I feel bad by not telling him, hey, you might not. But yeah, it was amazing. So I had a lesion on my liver. I had a 3.9 by 3.7 by 3.2 mass next to my adrenal gland, and then the nerve sheath tumor that was attaching to my spine. Well, they detected nothing on my liver. They detected no nerve sheath tumor, and the mass has gone down to 5.5 or 3.5 to like 3.1 or something. It's gone down, but the nerve sheath tumor is like gone. And they detected none of there was some other, I forget off the top of my head. There's a couple other things that had been detected. I think.
You're muted, honey. Well, what happened? You there, Denise? There you are.
I
So
don't know, my phone.
you're
So,
doing great.
so yeah, I was blown away that, I mean, it actually went away, and I feel bad for this poor technician because he literally thought he was doing something wrong because they scanned me 5 times the other day. And
Okay, so wait, I just have to hear this again. So in
okay,
20, was it the lesions came at what year?
okay, so 2021 was the last CT scan I had prior to this one last week, and
And lesions everywhere. And then
okay, so they did an MRI, a CT scan, and that all confirmed the same thing. I had a nerve sheath tumor that was growing from my adrenal gland, the mass by my adrenal gland, to my spine.
okay,
So
and now we redo it in 2023 and they don't see it.
right,
I just want to make sure I got that.
right, exactly. I mean, I have an appointment coming up to talk to the doctor. I'm curious what you know. Yeah,
How
it's
long have you
amazing.
been? How long have
I've
you been
only
on
been
this?
patching. I've honestly only been patching since March, end of March.
So like for 4 months. I mean, that's
Yeah,
amazing. I
it
feel
is.
bad for the guy. You're right. He must have thought he was totally like losing his mind.
So
Like
the
what
machine was broke.
happened?
Yeah, I mean, you know that they're scanning because the machine tells you to hold your breath, don't move, you know, and then brings you back out. So yeah, he made me stay on that table for another 15 minutes, and so he
Wow.
could do it again. It was kind of crazy, but I'm excited because it gives me a lot of, you know. Well,
So
I also have another
he
story.
made
I don't
you
know.
redo it. He made you redo it. He made you
Yeah, he
redo
wouldn't
the
even let me
MRI.
get up. Yeah, couldn't get up. I had to wait 15 minutes on the table, and then he came back in after 15 minutes and said, "Okay, I'm going to redo the scan again."
Okay, I just have to tell you because I've been doing MRIs forever with my stuff, and an MRI is not easy to be on the table. You go numb and stuff, and it's like tough. And that he made her do it even longer because
This was a CT scan, but I did have an MRI done prior to that. See, I haven't redone that test yet. They haven't
got
redone
it.
the MRI, but yes, they have.
I can't
So all
believe he had you sit. He
these
had
things.
you do it
You
all
know,
over again on the table. That is
yes.
amazing. So Denise, like, what you're a miracle is what I'm trying to say.
Well, you know, I'm not the miracle. I think LifeWave is the miracle. But I have another testimonial
Oh
that
yes.
my mom is sitting right here next to me. Is that okay?
Oh yes.
Okay, so my mom's 87 years old. No, she's going to be 87. She's 86 right now. Her birthday's next month. So I've been taking care of her for the last 3 years. I've stayed home and lived with my sisters. So I stayed home to take care of her. So she's been my focus for 3 years. I know her inside and out. And now my mom has kidney failure. So her kidneys are like 20%, 21%. My mom has chronic COPD from 50 years of smoking palm oil non-filters. And she also has an aortic aneurysm. Now, all these things were stable. We've had them stable. Okay. I just started patching her at the same time as I started patching. So, about 3 or 4 months. And she fell on June 4th. She fell we just gotten home from the casino. Yes. So we were just out for the day, and my sister was a little bit too far behind her, and she fell and fractured her pelvis in 3 places.
Oh wow.
Now, she also cracked 2 ribs. Now, with all the chronic other conditions that, you know, major things that she has, you know, obviously she went to the hospital. When she got there, I'm not going to mention the hospital, but when she got there, they left her in the emergency room for 24 hours. She developed pneumonia because, you know, she aspirated because they weren't paying attention. So long story short, that's when they found out she had the pneumonia, because I noticed it was hard for her to breathe. So I was like, you know, they were sending her home. They were ready to send her home. They weren't going to do nothing. They didn't even realize, you know, how bad it was. So I've had discussions. They admitted her to the hospital. She was treated for 5 days for the pneumonia. They said that, long story short, they cut her off of all fluids and everything. And basically said that we need to make, you know, have everyone come and do their final goodbyes to her. We flew family members out from Chicago, from different places, to say goodbye to my mom. The doctors were like, she's not going to recover from none of this. She won't survive the ambulance ride home to even go home to die. We just need to accept that. And, you know, so I was like, I'm not buying this, you know, because I had been patching her for months, and I didn't patch her the first week she was in the hospital because the doctors told me no. And I dealt with that. Long story short, she was awake. She was kind of coherent. Then they gave her some fluids, but then I left for the day, so they cut off all her fluids again. And then they overdosed her on Norcos. So because she didn't have any fluids in her to flush anything out. So she OD'd. They had to give her that drug, that Narcan drug, to bring her back because her blood pressure and everything dropped so low. It was like 54/48 or something like that was her blood pressure. So it was like they were done. The doctors told us that we couldn't bring her home to die. I was like, no. So I started giving her water behind her back. I was like, she wanted to drink. She kept asking for water. So I was giving her drinks of water, even though they said that she didn't pass the swallow test, she couldn't have it. So they basically gave up on her. They weren't giving her food, water. So I was giving her, so I started patching her about day 8 in the hospital. And now, mind you, after they OD'd her, they didn't flush out her system with fluids either. So she hallucinated for like 12, 15 hours after they overdosed her on it. Okay. So anyway, long story short, I started patching her with 8 different patches. Every patch that you guys have, I started patching her in the hospital. They take them off. I put another one back on. I'd use the old ones and put them around it. So by the time they decided they were going to send her home to die, she was sitting up in her bed, talking, telling when the ambulance came to bring her home, because they put her on hospice, sent her home to die. Basically, we got the comfort kit. They told us that food was for comfort only. As far as her eating when she got home, she ordered a pizza the second day she was home. Okay, so yes, and they told us that if she ever sat up in bed or got to get into a wheelchair, it'd be at least 12 weeks minimum before she could even move or lift her hips. Now, I added the X49 to her patches and the Elveda, and so I was patching her with everything. And I'm gonna let her say hi to you right now. Okay, can you say hi, Mom?
Hi, how are you? Oops.
Well, hi, Mom.
She said hi. She's hard of hearing. That's the only thing we're still working on.
Hey, she's doing great.
I'm gonna sit her up a little more. She literally walked from the bedroom to the living room the other day with the physical therapist. And she gets up to use the commode. They told us she wouldn't be able to move or survive the ambulance ride home. And she told them, So I was sneaking her water and sneaking her patches in the hospital, and she's all checking her hair. Look at her. She sees herself in the mirror, so she's checking her hair.
Your hair looks nice. You look beautiful.
So she's on no blood pressure. She was on different meds, so they cut off all her medications. So she's no longer on blood pressure medicine, on her heart medicine. She's on none of that stuff, and her blood pressure has been stable and normal since she's been home. She eats whatever she wants when she wants. She calls the shots here.
You can tell she's
How you
mama.
feel?
And look at how good you feel. Good.
Yeah,
Tell her what your goal is for your birthday, Mom.
I want to go to the casino.
Oh, you'll go to the casino, Grandma. There's no doubt.
What's the plan for this fall? Where do you want to go this fall with the
I'm
family?
going on a cruise.
And a cruise. I want to hear all about the casino, Denise, and I want to hear all about the cruise. And I want to tell your mom that your skin looks good. Look at how good your color is. Yeah, you look great.
Yeah, she's doing amazing.
Wow, Denise, thank you for introducing us to your beautiful mother. And Mom, thanks for winning. You just won. You won.
She wanted to tell you that her brother's 89. And she's going to be 87. So
Wow. Denise, thank you so much for sharing your story of
thank you for listening.
and these beautiful LifeWave patches. We're going to move it now to Dr. Stacy. And Dr. Stacy, wow, I don't even know what to say about this call. Go, please continue.
Well, Marcy, in the next couple minutes, obviously our minds are all blown. So how amazing, such a wide spectrum of experiences in these 3 ladies, and their results from the X39 stem cell activation. So how is that even possible? I have 2 minutes to tell you how that is. This is a non-transdermal patch. Now, you heard them talk about other patches, but I'm just going to mention the X39, the stem cell activation patch, because this is the workhorse of that line, right? No matter what, all people started with the X39 as the one to get to work to repair and regenerate the body. So this is a wearable light technology. We are light, we emit light. And when you apply the patch, embedded in that white part is a crystal lattice structure. And that lattice structure is what our inventor, David Schmidt, has created. It is made up of organic proprietary blend of amino acids, sugars, oxygen, and water. That lattice is reflective. And so when we put the patch on, our body's light reflects back into the body a very specific wavelength of light that elevates a peptide, GHKCU copper peptide, but in turn it elevates, mobilizes, and activates our own stem cell production. So no matter what's going on with these ladies, no matter what's going on with anyone, it's going to activate, elevate, and mobilize your own stem cells. Your stem cells are going to go to work to repair and regenerate whatever is needed in the body in whatever order is needed. And like you heard from Michelle, the longer you use the patch, the more results that are going to come, right? She's experienced things over years of time. And obviously Denise and her mother are fairly new at using the patch, but both already mind-blowingly amazing experiences using the patches. Imagine what's going to happen with them in another 3 months or another 6 months or another year or two, right? Mom's going to be at the casino as much as she wants, going on those cruises and enjoying her life with her family. And that's what this patch does. So when you get up in the morning, you put the patch on, you leave it on 12 hours, you take it off 12 hours later, you throw it away, and you do it again the next day, the next day, the next day, day after day, week after week, month after month. And you heard Marcy say earlier, my recommendation is stop patching whenever you want to start aging. Why am I still patching after 2 years? Why is Marcy still patching after almost 4 years? Because of stem cells. Our own stem cells go to work to keep our body young and youthful and healthy so that we can prevent things from happening and be able to live our best lives. So if you're interested in hearing more about this technology, go to startx39now.com, Michelle's beautiful website she has created, of course, with Marcy feeding her the amazing content, I'm sure, as well. But go to that website, startx39now.com. Look at David's clinical studies. He's done over 90 clinical studies, many double-blind placebo from independent labs and doctors all over the globe. Everything is there, including the patents. And get with that person that invited you. Let them know what patches you want to start with and what works best for you. They can help answer your questions and help you get set up. So with that, Mars, we're going to go ahead and stop recording for real.